this presentation to all the participants. So the PDF version of this presentation will be sent with the YouTube link when available. And please feel free to join. Rather to type your questions in the chat box during the course of a presentation. Dr. Barrett and I will monitor that, and we should be able to provide answers to any question you may have in the course of the presentation. And lastly, please kindly note that from April, we'll be taking online feedback. I want to know how we're doing, what you may need, so please, we'll be sending the link to the feedback to you with the registration. We will appreciate, please, if you can please give us your feedback on each webinar so that we can serve you better. And thank you again for joining today. Today's topic is prevention and treatment of coccidiosis in sheep and goats. And the presenter today is Dr. Barry Bagura. Dr. Barry, pardon me if I did not pronounce the name well, the last name well. Dr. Barry is an associate professor and director of the Tifton Veterinary Diagnostic and Investigation Laboratory based in University of Georgia. We are so privileged to have Dr. Barry share our expertise with us today, and I'm going to turn over the presentation to Dr. Barry. Thank you, Dr. Barry.
Thank you. I'm very excited to be here because I feel like it's part of our, one of the most important parts of our job as academia to actually, communicate with everyone in the land we're actually working for. So I would be excited to get any questions from you, and I would be happy to answer them. So today the topic is, as Dave said, coccidiosis in sheep and goats. So on this title slide, I already got you some pictures of the coccidia. Coccidia are causing coccidiosis. They're a pathogen that is actually a parasite, and they are very small. So they're just one cellular parasites or a protozoa, and they're very tiny. So this is a microscopic picture. Yes. Here we go. So today I would like to start with a little background, like occurrence and impact of coccidia, before we go to the main topic, which is prevention and control. So we would start with occurrence. So where do we see them? So risk factors for infection are manifold, and as a rule of thumb, we see coccidia everywhere. And you would know that coccidiosis is an important topic all over the country and all over the world, actually. So we see it in all climates and all types of herd management, though the biggest risk is intensive farming. So if you look at the upper picture, if you have a bunch of animals sort of closely together and housed at a high density, that gives, as for many diseases, a good opportunity to transmit it between individual animals. So this is where we would see the biggest risk. However, even if you have a setting like outdoors, like the lower picture here, with more space for each animal, that does not preclude that there is an issue. It's just less likely that it becomes a big economic problem. Usually young animals are most susceptible, and that is mostly because we would see the first infection in those animals. So they're not having any immunity at all. So they would just get the full-blown extent of coccidiosis. For the impact of coccidiosis, that is something that most of you probably are very much aware of. To get to the actual impact, and I apologize for this slide, I guess this is one of the most hated slides in my presentations in general. I'll still give it to you because it explains how this parasite sort of is different from bacteria or viruses that we usually see as infective agents. So parasites, worms, but also those little protozoa here, they have a life cycle that is a little more comprehensive and has several stages involved. And those stages are sort of set in stone. There's no way around individual stages. And they come together in a way that include an internal part of the development. So in the host, so everything above that line would be within the host, but we also need an external part that happens in the environment. And only if that full life cycle is closed, we will see infections happening. So we will not go into all details, but I would like to give you like a general idea how the parasite life cycle works. So essentially the infection happens with those so-called oocysts, which is like worm eggs, if you will, that are tiny, and they will be ingested. So if they eat, the animal eats the parasites as contaminant. What is depicted in the upper part here is the cross-section of the intestine. So you have the intestinal wall, and on the intestinal wall, you have a lining of cells that are your digestive cells here. And the interesting part about the parasites is that they will enter the digestive cells. So they are not hovering around them or taking nutrients out of the empty part of the intestine, but they will actually invade the cells here, use them as host cells, and take the resources of the cells. And within the cells, they will start multiplying as shown here. So one parasite goes in, and each sort of line within here would be a newly formed parasite. So we have an exponential multiplication. So you can, as a rule of thumb, say if one parasite goes in, it can be up to 1 million that are formed out of each individual parasite that is in that oocyst here. So that is an immense amount of parasites that are built per animal. And also each of them will kill the host cell that it's in. So once the multiplication has taken place, they will kill the host cell, which leads to an issue for the animal because it loses essentially its intestinal lining to the parasites. Then that happens multiple times, and then eventually there is another stage, which I'm not going into, but just to mention that there is also a sexual stage. So this is a very complex life cycle. And eventually we will have a new oocyst formed. And that oocyst is going into the free space of the intestine, the lumen, and will be shed with the feces. So this is what we can see through diagnostics. So those are actually those parasites that we've seen on the title slide. So they are the newly formed generation of parasites. These are not infective yet. That's what I meant when I said we need that external part or environmental part. So there's an extra part of the life cycle that happens on the pasture or in your animal housing where it becomes infective. That's called sporulation, which is just a fancy word for saying once this is done, we will see the parasite being infective. And then you can see inside those little tiny newly formed parasites, and this is actually what infects the next animal. So only after we have seen the whole internal part and the whole environmental part, we have a new generation of infective parasites. And that is something to keep in mind. If you have a fresh fecal dropping from a sheep or a goat, this is not directly infective to the next animal. It's only infective after it's stayed for a few days in the environment and can actually form those internal parasites here. I hope that makes sense. I know it's quite complex, but this is what it sort of sets it apart from bacteria and viruses that actually once they go through one multiplication here, they would be ready to reinfect. This is one thing where we have actually the whole complex thing. And in the very end, after several weeks, we will have the next generation of parasites that are in the environment and are infective.
Dr. Berry, someone said your slide is not full screen. Could you please make that full screen if possible? Thank you.
Say that again, sorry.
The slide is not at full screen mode. Your
Okay.
presentation slide, please.
Okay. I thought it was. I apologize.
No problem. Thank you.
Is that better?
It's still the same. That is
Yeah.
yeah. Initially when you first
Mhm.
did it was before we began the meeting was on full screen mode. Yes, yes, thank you.
Is that better?
Yes, thank you.
Okay. Okay. Sounds good. Sorry for that. I apologize.
No problem.
All right. So Due to that internal development, we will see intestinal damage. So due to the parasite multiplication with the destruction of the host cell, that will give you damage like this plate here. So this is the small intestine of a goat, from a goat that died. You can see here in that part, it looks bloody. So that is part of the tissue destruction. And then other parts of that will look with those white nodules. So this is here on the right side is just a part of that middle section cut open so we can look inside. And this is where the parasite replication or multiplication happens. So those are infection sites. And from each of those nodules, we will see thousands or hundreds of thousands of parasites emerging eventually to go into the feces and be spread on pasture or elsewhere. One problem with the coccidiosis is that we only see partial immunity. So an animal that has undergone coccidiosis will not necessarily be fully protected. Usually older animals that have had coccidiosis already will be protected against severe clinical signs. So they may not have significant diarrhea the second or third time, but they can still be infected and they can still support the life cycle of the parasite. So they will still be like multiplicator animals for the parasite. So older animals can contaminate the pasture even though you cannot tell that they are infected. Yeah. So for the disease that happens, we put that in two categories. One is clinical and one is subclinical. So the clinical or severe form is where you actually see the animal being acutely sick. So usually, and you know all about it, you can see diarrhea, you could see weight loss, you could see other secondary signs of diarrhea like dehydration, like a higher susceptibility to other infections. So those animals may need acute treatment. For subclinical or mild coccidiosis, a lot of times you have no significant signs. So in the moment where the animals are infected, you cannot tell that they are infected. So usually those go under the radar. But the problem is still, due to the infection, you can see reduced weight gain in a prolonged setting. So if you would monitor them, you would see that they grow slower. And also you would have prolonged hidden effects. There's not a lot of research in small ruminants, unfortunately, but we know from cattle, for example, that those would even have a reduced fertility. So if a calf had coccidiosis, a female calf, and you look at it a year or two later, you will see that they will be less reproductive. So that is something to keep in mind. Even though we might not see severe disease, it might still be a problem economically. And unfortunately, a lot of operations are dealing with the mild coccidiosis form, and that is hard to get a handle on. Just to mention it, based on the life cycle, just to say that once more, this is self-limiting. So once they go through the whole spiel of multiplication within the animal, there is no stages left. So once they form the new generation of parasites or oocysts, nothing is left. So they can start repairing the intestine, the animals. So that is something that will not cause a chronic infection. So unlike Johne's or other diseases, we're looking at something that comes and goes on its own. Which is great, but then again, we don't have the full immunity, so reinfections are somewhat common. To go back once more here, but very shortly, this is the slide we just looked at. So for an individual animal, what we're looking at is that we have several weeks of infection from start of the infection here where they eat it until we see the new generation of parasites excreted. And this is like a black box. So we don't know if the animal is infected until we see the final product of the infection, which is the oocyst in the feces. That's just something to keep in mind. For a lot of bacterial infections, we can test them anytime. After a couple of days, we will know if they're, if they have salmonella or if they have E. coli or whatever it might be. For those parasites, due to that life cycle, those internal stages are invisible to us because they're just from cell to cell. The only thing we can see is the final product, but at that point, we already have all those cells destroyed. So this is a little bit of a problem with coccidiosis, that we cannot have the monitoring of the herd as simply as for other pathogens. We can still have it, but it's a little more complex. So then if we look at the whole herd level, usually we can say that this is a seasonal transmission cycle. Just to mention that those coccidia are host specific, so infections have to originate from the same species. So we do not see a shared coccidia species between sheep and goat or cattle or other ruminants. So each ruminant species has their own parasites, and that is something that for a long time we didn't know. So if you look at older literature or talk to older sort of people, or that sounds bad, but just people that have been in the business longer, let's put it like that, be it on the academic side or production side, usually the original opinion was that they share them, so you shouldn't put goat and sheep together if one of them has coccidia. So today we know this is not the case. So just to say that they're separate. So we're looking at sheep separate from goat. The pattern is the same, and both of them, we're using sheep here, but they are not intertransmissible. That's what I'm trying to say. So the infection usually is a problem in the younger animals. So where do the first lambs get it from? So when we start lambing our kidding season, the origin of the first infection material is usually the ewes that have that partial immunity and will excrete some of the parasites. And then also low numbers may overwinter on pasture or may be present in your animal housing. So those are usually low amounts of parasites that go into the firstborn lambs or kids. Those will usually not have the biggest issue with it, but they will serve as a multiplicator, so they might show some clinical signs or not. But the biggest issue is that they will sort of multiply the parasite and contaminate the area for the next groups of lambs or kids to be born. So those will usually get, as the season goes on, a higher burden of those parasites. And that will usually go with more significant clinical signs and more severe coccidiosis. And then those go on to shed a lot of oocysts again. So eventually, towards the end of the lambing or kidding season, you're looking at a highly contaminated environment, and that's just by nature of that life cycle. The problem that we're looking at is how to control that and when to control that. So that leads us to the main portion of this webinar. So there are different parts to prevention and control, and I just want to mention upfront that specific treatment with anticoccidial drugs is actually a very important part of that, but it is, even though it's a big piece of the puzzle, it's just a piece of the puzzle. So there are several components to keep in mind, and I would like to start with management strategies, feeding and hygiene, which are core measures that also contribute a lot to control.
Dr. Berry, let me interrupt you before we go into that. There's a
Yes.
question that says, when you do fecal exams, what is the size of the coccidiosis as compared to Babaposworm's egg? Is, I think the person want to know, how do you get to know the size from other parasites, infected the animal?
Yes. Yes, that is a great question, and I will get to a picture of that a little later.
All right.
But usually those coccidia are about a quarter to a fifth of the size of a worm egg. So they're about 20 to 30 micrometers in length. And a worm egg comes in at about 80 to 100 micrometers, if that gives you a relation. So a worm egg would be about 0.1 millimeters. And the coccidia are accordingly smaller. Hope that helps.
Thank you.
Yeah. So going back to prevention and control. So the result that we're looking at is never like the full elimination of coccidia. That is something that is not possible, just based on the fact that they are very hardy and are able to survive under very unfavorable conditions. So complete elimination has not been described anywhere, even if you combine hygienic measures and rotation measures and whatever you can think of. So we're looking at reduction of the issues with coccidiosis and reduction of disease burden and economic impact. And that is completely fine because it gives animals the opportunity to build immunity, right? If you have some of them left, but not a lot, that will give enough stimulation for the immune system to being able to cope with coccidiosis, because later in life they might encounter a significant infection source. And then they are somewhat protected against disease. But we want to reduce it to a level where we don't have issues with it. So that's the basic mindset. As most of those populations of the parasite are in the outdoors, right? Because they are spread everywhere. So it's really hard to embrace the idea of eliminating them unless you sort of build a completely new facility and put in animals that have been treated for many times to make sure that there's nothing in them. But it's not something you would try to achieve in your normal setting. And you don't have to. So looking at prevention with management measures, the first goal would be to reduce the infection pressure, so have less of them in the environment. And the second goal is to make sure that the animal is able to deal with it, so sort of reduce their susceptibility to disease effects. Just to give a brief overview, and we're going to go into that a little more on the next slides. So for reducing the infection pressure, the main risk factors are high animal density, because that fosters the transmission, and warm weather conditions. And that is just because the environmental part of the life cycle where the parasite is rendered infective, that takes a couple of days, is quicker under warm and wet conditions. So this is what the parasite sort of enjoys and thrives on. So that will give you a quicker turnaround to the next generation of infective parasites. For the animal part of that, so making the host less susceptible, those are a lot of things that you all probably are much aware of, like reducing animal stress, reducing concurrent infections, if we have an indoor setting, we have some means to control the climate, look at ration and ration change and shipping stress. So those are all things that you would try to think through when thinking about the timing, in terms of how does it relate to coccidiosis exposure. So the first one, reducing infection pressure. So that would be the bigger part would be reducing the number of oocysts that we have in the environment. And a smaller part would also be, are we able to remove the oocysts before they are infective? So once the animals drop the feces, is there any way to reduce the amount of feces so those oocysts don't even have a chance to become infective and pose an infection source for the next animal? Management factors that can feed into that are group size. And a lot of what I'm saying here to probably make sense for a lot of different reasons, and coccidiosis is just one of them. So the group size, essentially, if you can reduce it, that's of benefit, because then there's less animals to cycle through for the pathogen. So usually you don't want to reduce your herd size, but you want to break it down in multiple fenced areas, or if you have an indoor setting, to put several pens to sort of keep them apart. Usually what you're trying to do is to look at the group composition. So similar ages would be grouped together. This is what most producers do anyways. Some producers, mostly in larger operations, regroup their animals at some age, be it like 2 months, 3 months, just based on weight rather than age. This is not necessarily recommendable in the view of coccidiosis, because in that point, it could happen that you put younger and older animals together. So the older ones might be the ones that already shed the parasites, that are already a couple of weeks into the infection, while the younger ones might be just the susceptible ones. So you put like a direct infection source next to a susceptible animal, which is not perfect in that setting. Again, it's not transmitted between different ruminant species, so it's no issue to have a mixed population in that regard. So rotating pastures is also something that makes sense for a lot of reasons. Coccidia generally, as I said, are quite hardy, so they can survive weeks to up to a year or even longer, depending on the setting. And most field conditions, if we have some sunshine, that is pretty efficient in killing them because they're very susceptible to UV light. So usually a couple of weeks are what we're thinking for the majority of the oocysts to stay infective. So if we have some rotation in place where we can get the susceptible animals away or the younger animals away for a couple of weeks and then come back, that makes a big difference. Hygiene factors that feed into that goal of reducing infection pressures would be the planned approach, going from the youngest or most susceptible animals to the older or immune ones. So if you clean out, you would start with your fresh equipment and the younger animals areas and then go from there. Elevated feeders have been shown to make a huge difference just because it's less likely that animals would drop feces in there, or that animals tend to, like younger animals tend to eat bedding across with the feed. And it would also help to avoid hot spots where there's like a lot of feces and a lot of feed together. For cleaning, it's recommended for indoor settings to do that regularly within 2 or 3 weeks. Days, so twice a week, sorry for that. Essentially, the idea is to remove the oocysts before they become infective, and then also make sure that there is clean feed and water. For the disinfection, I put that in parentheses just because coccidia are not very susceptible to a lot of disinfectants. So most disinfectants will not act against coccidia. The one that is most promising is bleach. It would have to be a quite high concentration of 10%, and it would have to soak in bleach for at least 2 hours for equipment and also for pen walls or whatever you want to disinfect, even the bottom. So that means a lot of times you would have to go back and re-wet the surface a couple of times to make sure that the oocysts are exposed to the right concentration over that 2-hour period. So that can be very tedious, but this is the one treatment that is shown to be highly efficient in terms of disinfection. If we look at pasture, obviously disinfection is very difficult to achieve and not really something that is considered. For the second goal of reducing animal susceptibility, that usually comes back to fostering a good immune response. So as I said, stress plays a major role. So feeding is part of that. So making sure that they have all nutrients and minerals, supplements as needed. And if there is any change in feeding, that this is gradual, will go a long way for those susceptible ages. Colostrum is mentioned here and vaccination. The tricky thing is that neither colostrum nor vaccination will act directly against coccidiosis. So there is no vaccination in any ruminants against coccidia. And this is not something where we are alone, but this is worldwide. So there is none. For colostrum, it's the same. The colostrum will not have a significant effect on coccidia. So all the antibodies that come from the mother will not translate into protection of the young ones. However, what it does is protect against concurrent infections. So if you have protection against, say, specific strains of E. coli or against Rota or coronavirus, that will help a lot in giving the animal more resources to fight off coccidia. And the same for vaccination. If you vaccinate against other pathogens, that will help the animal focus on coccidiosis control with their immune system. Reduction of secondary infections, usually that goes the same route, making sure the immune response to coccidia can happen. So that would be up, again, you know more about it than I do, hygienic measures, and also make sure that not only intestinal diseases are prevented, but also pneumonia and other diseases somewhere that can interfere with the animal general health.
So, Dr. Berry,
Yes.
what about the fact that Is ammonia or steam cleaning an option for disinfection?
Yeah,
Ammonia.
those are not efficient against coccidia, unfortunately.
Oh, okay. What
Yeah.
about regular bleach diluted to about 10 to 15%? That's with
Yes.
sodium hypochlorite?
Sodium hypochlorite, you can use that, but you would probably want to use that for several hours at a time. And you would have to use a high concentration. I don't know out of the top of my head how much that would be, but if I can follow up on that.
All right.
But it needs a very high concentration of that. Yes. And the problem is, if you look at the picture of those oocysts, they have a very thick wall, and only inside of the wall you have those infective stages. And the wall is like a whole protection bubble around them. So this is why they are so hard to disinfect.
All right. Thank you.
Yeah.
One more question before you
Yeah.
go on. You mentioned sunlight exposure can kill oocyte. So taking animals off pasture can reduce infection rate. How long should pasture to remain empty? I didn't get that. So she was asking if sunlight exposure can kill oocyte, like you mentioned.
So how long?
So how long? So taking animals off pasture can reduce infection rate. Is that correct? When you
Um,
take animals off pasture, can that reduce infection rate?
if you take out the infected animals, that reduces infection rate for the other animals. Is that the
Yes, no, because sunlight exposure can kill the oocyte. So when you take off the animals off pasture,
yeah.
can that reduce infection rate on the pasture?
Yes, so it would lower the contamination. Probably there would still be some around because the animals picked it up there, so something is in the environment. But it would lower the infection pressure. So there's less oocysts eaten or less parasites that are eaten per animal. And that is important because that will cause less damage in the intestine, less destruction of the intestinal cells. So that will cause a much milder form and less economic impact than if you have the animals excreting like the new millions of oocysts under the same pasture and the next animal can eat it, if that makes sense. So you would sort of dilute the infection if you take out the major shedders. Does that answer the question?
Yeah. Thank you. Can continue.
Yeah, and usually, I did not mention that, but usually the excretion after infection, like once they start excreting the new generation, it's only for about a week. So after that, they're cleared, and you can put them back.
Okay. Thank you.
Yeah, should have said that. All right, so that was for the general measures that we can take to reduce infection and reduce the impact of infection. And what we're looking at for the targeted part is three different things: anticoccidial drugs, supportive care, and alternative measures. And we'll focus mostly on the anticoccidial drugs now, because this is what we're having as major pillar for our control. So I'm planning to go over which drugs to use, how to use them, when, and which animals to treat. So which medications do we have available? Our anticoccidial drugs, so everything that fights coccidia is called anticoccidial drug, are actually grouped in two different groups. So the first one is coccidiostats. That term is sometimes used like as an overarching term for everything that is used to control coccidia and coccidiosis. However, more defined, it is the group of anticoccidial drugs that will arrest the parasite development. So it's the short version of coccidiostatic drugs. So static means they will hinder the development of the parasite, but they will not kill it. So usually what they do is they starve the parasite of specific nutrients. So if you give them for weeks on end, that will eventually kill the parasite. But if you withdraw the medication after a week or so, they can come back from that. So the parasites will be able to recover if you don't treat them long enough. On the other hand, we do have coccidiocidal drugs. So those are cidal sort of indicates that they kill the parasite. So they will actually destroy the parasite structure. So they have a different mode of action. This is more sustainable. However, you still have to have your timing right, because not all of the coccidiocidal drugs will work against every internal stage. So some of them will work against the infective stage just when it hits your intestinal cells the first time. Others will work against later stages in their internal development. So that means still, usually those are applied over a longer period of time just to make sure that you get your timing right. For the coccidiostats, we do have different options here in red. So the ones that are used mostly are decoquinate and amprolium. I gave some trade names just to maybe relate it a little more. So decox is actually, decoquinate is actually approved for small ruminants. However, it's not for lactating user dose. And amprolium or curd, it's extra label use. So this is not licensed or approved. So it's used, it's efficient. However, it should only be used if there is no other approved option. That makes sense for that operation. So for the coccidiocidal drugs, the triazines are beautiful drugs that you only give once. However, they are not licensed in the US, so they're off the table. So we're focusing on ionophores. The two that are used a lot in ruminant production are lazuloside and monensin. Lazuloside is licensed for sheep in confinement, but not for goats. Monensin is the other way around. It's labeled for goats in confinement, but it's not labeled for sheep. With monensin, there is toxicity if you overdose it. It's also toxic for humans. So this is something, again, a lot of you will be aware of that needs to be handled with care, but it is highly efficient. So
Dr. Berry, I'm
yes,
sorry.
no, it's all
There
good.
are questions, that speaks to the slide. The first one is, does lactating means used for milking, or does that include nursing lambs? So decox for lactating ewes, are you talking about milking animals or just animals that is nursing?
Yes. So that is for the milking.
Okay,
Yes.
milking. Okay, all
Yes.
right. So does coccidiosis build resistance like dewormers when you use the medication?
They do. They
They
do.
do.
So having said that, in the ruminants, we're not aware. So there's no studies that shown resistance of coccidia in ruminants. So neither cattle nor sheep or goat, we have described issues. However, we see that a lot in poultry where they treat quicker and more often with anticoccidials. So there is a potential for that. So I would never exclude it. I would always caution that this might become an issue. And if you look at this list, there's really not a lot of options right now. And there's none that I would be aware of that are coming onto the market in the next years. So that means we have to make do with what we have available. And that means we have to be very careful how to use it. And this sort of comes into play when I go into which animals to treat in a little, like in a couple of slides. Yeah, it is an issue potentially.
All right, two more before you go on. So is a chlorhexidine effective in combating coccidiosis? Chlorhexidine
It's not,
is
unfortunately.
not.
It's
All
not.
right. Okay, so somebody wants to find out if you can please go over curried one more time. The prolium, the curried extra label. Can you please go over that? I think that she needed more information on that, please.
So what it is?
She just wanted to repeat what you said on
Yes.
curried extra label for sheep and
Yeah,
goats.
I was just saying that this is efficient. However, it's not labeled for sheep and goats. So you can not use it as easily. So that means usually what happens is you start with the ones that are labeled for the species we're looking at, sheep or goats. And then if you do not see the expected results, so it's not working the way it should, then you're free to go to extra label drugs, but it's not supposed to happen that you start with an extra label drug.
Thank you. You may continue. Thank you, Dr. Berry.
Yeah, absolutely. Those are great questions. Thank you. So how are they applied? You know that most of them are feed additives and Prolium. The carrot is also available as drench, which gives it a leg up for very young and suckling animals, because those can be dosed directly into the mouth of the animal. So this is where, for example, extra label use might make sense if you cannot apply anything that's in feed. For the feed additives, using a feed mill is strongly recommended just because the dosage needs to be right. So overdosing can be toxic. For example, monensin has a very, very small range of tolerance. So you have to make sure that it is applied in the right dose so you don't harm your animals. Or yourself when you deal with it. If you have the powder, that's not recommended because it's really toxic to humans. And underdosing is a problem because then it is ineffective. So not only does it not kill the parasites or does not starve the parasites, but also we run into potential issues of what was mentioned before, drug resistance, where it might not be effective on the long run if you train the parasite on that drug, but you don't really kill it. So the next point on my list would be when to apply medications. So this is a timeline. So as I said, infection is the first part of the whole story, but then we have a long internal development until we get to the start of oocyst shedding. So this is our black box here. We don't know that it's happening unless we see clinical signs and say, oh, this animal has diarrhea. It might be coccidiosis, but we cannot prove it. So according to this infection timeline, we have 3 possible timings for the treatment. So the first one is prophylaxis. We all know prophylaxis is to prevent infection in the first place. This is the intestinal mucosa that the parasites will sort of feed on and destroy. So this is just a view onto the inner side of your animal's intestine. So you see those ridges. There's a lot of digestive surface that is great, and everything is covered with digestive cells. This is what we want to keep, and prophylaxis will just keep it the way it is. Then we have metaphylaxis. That is still a preventive treatment. It happens during that time of internal development, which we don't know where the animal stands, honestly, if it's here or if it's already infected and we just don't know. The third option would be therapy. You can see here again the inner side of the intestine, and you can see here that there's a lot of destruction happening already. So you have a lot of cells that have been killed by parasites. So this is what we're trying to avoid. This is why therapy, once we can prove there is an infection because they start shedding the oocyst, at that point, we already have a lot of damage. So actually, this is what we're trying to avoid. So we're really trying to go for a preventive treatment. So somewhere here where the animal does not shed oocyst, if it's not infected yet, or if it's infected, but within the development with less damage than here, we try to aim here. So once we see infection, that's our last resort to treat here. We're trying to get it here. And to prevent not only disease, but also transmission, so we don't see oocyst production and no further contamination of the environment, if that makes sense. So this is what we're trying to do. Again, diagnosis only happens starting here. Where does it fall with the whole herd? So usually we see the infection dose and related disease burden is here. And then we see over the season an increase in problems with coccidiosis. And that means that animals are exposed at a younger age to a higher number of parasites in the environment. So usually what happens is that lambs and kids that are exposed become sicker at a sooner age. So the first generation may take about 8 weeks to actually display clinical signs. And later into the season, a lot of producers might see that it's earlier. So even younger lambs or kids might be affected. And the second is that animals are at risk for a prolonged period of time as they accumulate in the environment. So be it pasture or indoors, you will see more and more parasites. So that means animals will be able to catch it for a longer period of time as they're just sitting there waiting to be taken up as a contaminant. So what are our options for the herd setting, as we don't know when the animals are infected before they start shedding oocyst? So one option would be to start treatment the second week of the lambing season, because this is where we want to avoid the first lambs to start shedding. parasites, and then keep it up through the whole season. This is a valid scenario. You can do that. It's just somewhat expensive to have the feed additives mixed in the whole time. The second option would be to check the herd for Coccidia species and burden. So what is around in the fecal samples, and sort of do that in a weekly or bi-weekly setting, and just collect those samples, have them analyzed, and determine when the first lamb or the first kid or the first group of animals are positive, and when we see an increase in numbers that are present in the fecal samples, indicating a higher burden. So that would be something that is more sustainable, I will say. So to make it a little less expensive, you could consider pooling samples from the same age group. So collect from 8 or 10 lambs or kids, and then sort of put it into one big bag to give you an average idea what's happening over time. That still creates lab costs because the testing isn't free, but it reduces your treatment costs. So it's like a balance, and overall it's more sustainable because you use less of the drugs. Just to give you one example, and the pricing varies over the country, but our lab charges between $17.50 and $26.50 per sample, depending on like how much detail you want. So this would be just a plus system, like it's low, medium, or a lot of parasite stages, and this would be an exact count. So generally, I would recommend checking and just monitoring and keeping track what's really happening in that herd or flock. Coccidia testing, just to sort of branch off into that a little more. Just keep in mind that coccidia excretion is not steady, but it's like the push at the end of the life cycle for a week or so per animal. So the self-limiting character of the infection comes back at the diagnostic end. There are only fecal tests available. There's no blood test at all. It always makes sense to test multiple animals, and they are somewhat scattered in their infection time point. So to know what's going on a herd level, you have to screen a group of animals, and you can still pool it to make it worth your money. There are a lot of specialized veterinary labs that can give you the quantity. So if you have a higher or lower burden, or if that sort of increases over time. And also some labs, not a lot of them, but some labs will be able to do a species ID, because there is a lot of different coccidia, and some of them are just like your normal flora, and others will have a lot of pathogenicity and will cause a lot of problems, and you might not want to treat against all coccidia, but just the species that are important. So if you have a lab that looks at that, that might be beneficial. Our lab, for example, does it, but you would have to check up front which lab you could use for that purpose. Also, a lab will give you other parasites at the same time. And here we have a picture with worm eggs. So those are roundworm eggs, like the barber pole, for example, the barber pole worm. And then you have the coccidia in between to give you a size comparison here. And that would help guiding when and which animals to treat, because once you see the whole herd picking up with higher excretions, that might be a good time point to go and treat the susceptible animals. And that's something that's different for each operation timing wise. So some operations might have to start in January already, and others might only start like start of April. So that's something, once you get the hang of it, you can likely transfer into the next year and keep your pattern similar. All right.
Okay, Doctor, just about 3 more questions before we go
Yeah,
there. A lot coming up, and I
absolutely.
think so. Someone wants to find out. She lives in Wyoming, so she wanted to find out if there's a lower risk of oocyst survival in Wyoming as opposed to living in the South, where it is more humid.
Yes. So usually in Wyoming, it's pretty arid, which is good because those parasites live longer under moist or humid conditions. However, there's different factors that go into that. Like, as I said, intensive versus extensive. In Wyoming, there's a lot of extensive farming or ranching, so that's again good. I guess I would suggest monitoring it, but if there's not a lot coming up the first year, probably it's not going to be an issue for the following years either, unless you see clinical signs. But having a sample would be good because there's so many factors that go into it. But per se, I would say, like, if you have extensive ranching and you have low humidity, that is actually good.
Great. So someone was asking about using Sericel Expediza, if it controls coccidiosis because of the tannin present. Any thought on that, please?
The timing of the
The tannin. I read we agree, when you graze Sericea lespedeza variety, which is the AU grazer, does that prevent coccidiosis? We have tannin in lespedeza, and she wants to find out if the tannin can help prevent that occurrence.
the timing of the lambing season?
No, the tannin in lespedeza. That is I'm going to send you that information so I don't disrupt
I'm sorry,
your.
I cannot see the chat. Oh,
No
maybe
problem.
I can. Maybe I can.
Tannin, don't worry.
Oh,
Yeah.
I see. Now I got you. Sorry. That was just a word I was not expecting. Yes. So, it might not prevent it, but it might help. And I will hopefully get to it. I'm sorry, I'm running a little short on time, I suppose. But I do have that's like one thing to consider as alternative treatment. It's not as efficient as actual anticoccidial treatment though, but it can support it. Yes.
Thank you. You may continue because of time. Thank you. We're going to take other questions.
I'm sorry.
Yeah, no problem.
Okay. So just to sort of summarize, how to use your anticoccidials. So once you determine the time point and you determine that it is a good anticoccidial to start with, like the substance that you want to choose, it makes sense to always treat the whole group of susceptible animals because of that black box scenario. So you cannot just look who's excreting, but you want to prevent it in the ones where you cannot find it yet. So you would treat the whole group. You would usually treat it for at least 28 days, just to make sure for the coccidiostatic drugs that they have enough time to sort of starve the parasite of nutrients. And for the other ones that your timing sort of falls into the right part of the developmental cycle. And what is also important that a lot of diseased animals obviously will eat less. So you have to check the feed intake because the dosage is per pound of your feed. But if they don't eat what they're supposed to eat, the dosage may be too low. So you might want to switch, for example, to amprolium that you can drench and make sure that the dosage is right for the very sick animals. And also, you might want to consider the withdrawal times. They might vary between the different products. So just to make sure if you want to send them to slaughter that you withdraw in time to have no issues on that end with the meat quality. All right, so then should we treat the ewes? Because the ewes are the reservoir, right? So it would make sense in a way to treat the ewes. As touched on before, there is a risk of resistance development against the drugs. So we might not want to use them in every animal on the operation, but just on the ones that will actually display disease or develop disease. So the ewes are not recommended to be treated. Should we treat year-round so we prevent that sort of hike or spike in the lambic season or kidding season? Again, that is not recommended because of the risk of resistance development. So you want to have the coccidia in touch with the anticoccidial drugs as little as possible. So you want to use it as you need it, but not go above that. So this is where diagnostics can come in handy to sort of make sure you have a targeted timing. Then just to touch on the last two portions of the targeted treatment, so supportive care. So you want to support the animal's overall condition so they can recover. You want to support the immune system so they are protected against the next round of infection and also digestive health so you don't lose out economically. So components of that obviously are fluid replacement. Palatable feed comes into that, so they are inclined to eat what you present to them. Pre and probiotics can play a role for intestinal health because we know that due to the lesions in the intestine that are caused by the parasites, we can see overgrowth of bacterial pathogens. So if you counterbalance that with pre or probiotics, that can also help stabilize the diarrhea issue. And antibiotics can come in if you know that you have secondary infections. They will not help against the coccidia, but just to, again, reduce the overall inflammation that is going on in the intestines. So that leaves us with alternative measures. So those are usually aiming at limiting or avoiding drug use. They can be very handy in organic production settings where we are not allowed or supposed to use anticoccidial drugs that are antiparasitics. And the idea is that coccidiosis is self-limiting. Once they go through the life cycle, that will stop. So we have pretty good chances if we support the animal over that limited period of time that we have the internal development. There is unfortunately not a lot of studies done in ruminants. We have a few studies done in poultry. Some of them are very promising. But we have limited ideas about what happens in ruminants once they sort of digest with their specific rumen system. They might not be as efficient in the intestine as it might be in birds. What we have as options are usually plant extracts like oregano oil or essential oils, and legumes or pea plants are also investigated. I just wanted to give you two examples. One is wormwood, which is applied as leaf powder. This is also supposed to reduce roundworm infections. We see both in broilers and in sheep that it has some efficacy. However, it's not consistent in improving body weight gain. So it's good to reduce the number of parasites that are put out onto your pasture, but it's not necessarily said that it will enhance the performance of the individual animals that are treated. Similar for Sainfoin, and this is probably similar to other plants that you can graze on. So they contain condensed tannins, which is good for intestinal health. They also will lower parasite excretion rates, but not necessarily improve body weight gain. So just something to keep in mind if you want to look a little more, I guess, zoom out and look a little more into the herd health. Those can be very valuable, but they will not prevent issues in the individual animal necessarily. So the take-home message is first, make sure that you're dealing with coccidiosis, and at best that you're dealing with coccidia that are pathogenic and not some species that you can ignore and look for other pathogens instead if you have issues. Then combine preventive measures with targeted and timely treatment. So make sure your timing is on spot to sort of come in the preventive window. Then monitor the herd over production cycles to make sure that the timing doesn't change over time, and that is done with pooled samples sent to the lab. And the whole idea is not to eliminate coccidia, but to reduce them to a level where we can actually deal with it and the animals can deal with it. And that's the most important part. That's it. Thank you so much, and sorry for running a little longer.
Thank you, Dr. Berry. I appreciate that. For us to maximize the remaining 4 minutes, I sent some questions to your chat box. It's a private chat box. If you can please access that. And I apologize for sending the first 3. They are the same questions. Can you just see that in your chat box?
Yes,
so it's better for you to read so I can answer that. The first 3 are the same, and I apologize for that.
No, it's all good. Yes. So I guess where are we starting after the Sericea lespedeza, right?
Yeah.
Yes. So decox and feed, yes. Yes, you can definitely do that. So that is a feed additive. And the next one with choroid, yes, that depletes the parasite of thiamine, which is a vitamin B. So if you give it for a prolonged period, you might want to add thiamine as an additive to your feed. If you use it for like a 28-day window, you can, and you don't overdose it, usually the sheep and goat can deal with that. So it's more if you really plan on giving that over several months, or if you're dosing it at a higher rate. Is there a threshold at which to treat for an individual animal? That is a beautiful question. So there is a threshold for the pathogenic species. As I said, some of the Coccidia species will not play a major role in production at all. But if you just get a total count, it's really hard to tell how many of them are a problem and how many of them are not. So there is no overall number. If you have it broken down to sort of give you the different species, for the pathogenic species, like they're called Americandalis, Ovinoidalis, and two others, you can say that probably an excretion of more than 1,000 of each of them is an issue. So again, the total number is sometimes hard to read if you don't know which species you're dealing with. Then I use Bovatec and quick fractions. Yes, so Bovatec is a good choice. The only thing with that is, again, that the timing needs to be right, because you need to treat while the animals are in the environment where they eat the oocysts. So if you use it and you stop it, and then you put the animals still in an environment where they can be infected, they can pick it up. So you have to cover the period where they are exposed to the biggest portion of the oocysts. So if you feel like you're moving them into the next environment and there is still a significant risk of infection, you would have to keep feeding it, or keep feeding something. Let's put it like that.
Yeah, we're going to take the last one, Doctor. Thank you so much.
Yes. The last one. So if the marquee.
Yes, vets are
Yes.
recommending. Yes.
Yes. The ponazuril is actually a triazine, where I said it's not available for livestock in the US. This is a beautiful medication. I did a study with it, not me personally alone, but in conjunction with Dr. Whit Stewart at the University of Wyoming, who is a sheep extension specialist. So we found that this is highly efficient if you use it twice, but it's not licensed. So yeah.
Dr. Bird, Genesis says she doesn't feel our question was answered. If you say the last one, I don't feel that my original question was answered.
Which
for
one?
disinfection. Do you see that, Genesis? The last question in the chat box. She was talking about regular bleach diluted to 10%.
Oh, yes. So diluted to 10%. My apologies. Yes. So 10% of a 5% product.
Okay. All right. Thank you so much, everyone, for joining us today. Dr. Barrett, I want to say thank you for your time and your participation. We really, you give us a very good insight into coccidiosis. And like I said, the recording and the PDF version will be made available to you all when it is ready. And we hope to see you all again in April with another very informative webinar topic. Once again, thank you, Dr. Barrett. Thank you, everyone, for joining, and have a most blessed day. Bye.
Thank you.